Former FDA Commissioner Dr. Scott Gottlieb is sounding the alarm about the highly contagious Delta variant of COVID-19. Sunday, he told Face the Nation infections could surge by the fall. Gottlieb said aggressive estimates show they could reach 20% of last winter's peak. The biggest problem in the fight against the virus right now, falling vaccination rates.
And I think the risk is really to the fall that this could spike a new epidemic heading into the fall. The vaccines seem to be effective. The mRNA vaccine seems to be highly effective. 2 doses of that vaccine against this variant. The viral vector vaccines from J&J and AstraZeneca also appear to be effective, about 60% effective. The mRNA vaccines are about 88% effective. So we have the tools to control this and defeat it. We just need to use those tools. I think in parts of the country where you have less vaccination, particularly in parts of the South, where you have some cities where vaccination rates are low, there's a risk that you could see outbreaks with this new variant.
For more, let's bring in Carl Zimmer. He writes the New York Times Matter column and is also the author of the book, A Planet of Viruses. Hi there, Carl. So what are states doing to incentivize vaccinations, and are those measures working?
Well, they are trying to make it easier to get vaccinated. You can go, pretty much walk into drugstores and get a vaccine. There's not a big demand on those bookings. There have been some creative solutions, lotteries, for example. And there's just been a lot of general outreach to try to get people to appreciate that the best long-term way to protect your own health and the health of others around you is to get vaccinated.
Well, a new study out of the UK suggests that COVID-19 could actually shrink parts of the brain. What can you tell us about that?
Yeah, so this was a study where scientists took advantage of the fact that a huge number of people in Britain have volunteered to have all sorts of studies done on them, including having their brain scanned, having their DNA sequenced, all sorts of stuff. And so this database was already there before the pandemic. And so some scientists decided to take a look at some of these people who had then gotten COVID and scan their brains again. So you have this before and after look. And it's quite striking that there are certain regions of the brain that on average seem to have slightly shrunk in people with COVID. These are people who were not necessarily really sick with COVID. These were even people who had no symptoms at all. We know that COVID is not just a lung disease, it's a brain disease. And this is a really sobering take-home message that, we really need to take this very seriously. And just because you didn't get really sick with COVID doesn't mean that you're out of the woods.
And Carl, I remember reading, correct me if I'm wrong, something about how, in fact, when you look at those patients who seem to have lost their sense of smell, this could explain part of what was happening there. Is that right?
Yes, that's correct. You could potentially be seeing some of what is going on when people get COVID-19.
So the U.S., we know, Carl, is starting to turn its attention from prevention to treatment. The Department of Health and Human Services announced that it is speeding up clinical trials to test a pill in COVID patients. What do we know, Carl? How would that work?
So there are certain viruses that you can actually just take a pill and it will either fight back the virus or wipe it out. So hepatitis C, for example, there are pills you can take that are a cure. It's quite remarkable. So it would be great if there was a pill that you could take similarly for COVID. We don't know if such a pill exists, but it's certainly worth taking a look. So the U.S. government is putting in over $3 billion to support research on these oral antivirals. Some are already in clinical trials. Companies like Merck and Pfizer are developing some. And there's more basic research in the pipeline that might lead to even more effective drugs. Even if we do get more people vaccinated, there's still going to be a need for these kinds of treatments.
And Carl, not to get too in the weeds on this, but is the science behind this sort of latest research, is that actually new? Because during the process of this mRNA vaccine development, there was a lot of emphasis on how, while the use and the application for the COVID-19 virus, or the coronavirus, was new, that the actual science behind it, the delivery of this system into people's systems, rather, that itself wasn't new. What can you tell us about this pill treatment? Is this something new?
Well, the basic approach has been in place for decades. Basically, what you want to do is you want to find some molecule that's going to be able to grab onto the proteins that viruses use to make more viruses. That's the basic idea. And that has been successful in recent years against other viral diseases. So it's really just a question of, in some cases, maybe there are actually antiviral pills for other diseases that are just waiting for us to discover that they work against COVID as well. And actually, there are some trials for pills that were developed for influenza and other viruses. They're going on right now. So we'll see. Chances are that if you look up close at the coronavirus and really get to know its molecular structure, you might be able to make an antiviral from scratch that will work really well against it. But that takes a lot of work, and that's not going to happen overnight.
Okay, still fascinating to hear about all these new details. Carl Zimmer for us. Carl, always good to have you. Thank you.
Thank you.